Let's discuss treatment principles in the case history number 4. This is a case of a woman aged 24. The clinical manifestation, this patient had an exterior condition overlapping a chronic interior one and only came for treatment after the exterior condition had set in and penetrated to the interior. As this is a complicated case, the clinical manifestation is divided into 3 groups: the underlying chronic condition, the acute, and the exterior attack, and the sequelae of such an attack when she came for treatment. First, for the chronic condition, propensity to catching colds, giddiness, deep fine pulse, both rear positions very weak. For the tongue, it is pale purple, dry. Number 2 is acute exterior attack. The temperature is 101 degrees Fahrenheit. Feeling of heaviness, body aches, headache, buzzing in the ears, giddiness. Number 3, the sequelae, constant temperature of 99.5 degrees Fahrenheit, lack of balance and coordination, tinnitus, nystagmus, extreme tiredness, poor sleep, lethargy, feeling of heaviness of the legs, numbness of the limbs, occipital headache. In particular, the lack of balance and coordination was very pronounced and led Western doctors to suspect a neurological lesion. For the diagnosis and explanation, the chronic condition, severe kidney yang deficiency. In this case, the tongue is dry from deficient yang qi, unable to transport fluid to it. It is also purple as the deficiency of kidney yang has caused interior cold, which in turn causes stasis of blood. For the number 2, the acute exterior attack, this was an attack of the exterior wind damp heat. For the sequelae, these are caused by the exterior pathogenic factors penetrating in the interior. The heat and dampness have become interior and caused the constant low-grade temperature. Once in the interior, they disturb the circulation of qi and blood and overlapping with the pre-existing condition of kidney yang deficiency. They cause the rising of liver wind, resulting with the symptoms of nystagmus, lack of balance and coordination. These are caused by interior wind arising from the deficiency of blood and kidney yang. In addition, damp heat is steaming in the interior, causing the constant low-grade temperature, numbness, extreme tiredness, feeling of heaviness, and lethargy. For the treatment principle, the patient only came at the sequelae stage. When the condition was an interior one, it has characterized by an extreme deficiency of upright qi and by the presence of formerly exterior pathogenic factors now become interior, which is damp heat. In addition, the exterior attack had also given rise to another interior pathogenic factor, that is liver wind. This is one example of a situation when the manifestation becomes primary. The root is represented by the chronic condition of kidney yang deficiency, which must eventually be treated as it also predisposes to liver wind. However, the manifestation in this case assumes primary importance as it causes symptoms which require urgent treatment. The manifestation in this case is represented partly by damp heat and partly by liver wind. Both, this particularly the liver wind, need to be treated without delay. Treatment in this case was aimed at treating the manifestation first and expelling the pathogenic factors first and later tonifying the upright qi. The treatment was aimed at clearing interior heat, resolving dampness, extinguishing wind, and pacifying the liver. Various groups of points were used at different times to achieve these aims. LI11 and Loop 14 were used to clear interior heat. Points on the governing vessel are particularly important to clear latent interior heat resulting from invasion of previously exterior heat. Points such as spleen 9, spleen 6, Ren 9, bladder 22 were used to resolve dampness. Liver 3, GD 20, DO 16 were used to subdue liver wind. Only after the symptoms of damp heat and liver wind had gone was the treatment aimed at tonifying kidney yang by tonifying and warming bladder 23, Ren 4, and kidney 7. Thank you for your attention.